Please stay present for the record. You can unmute yourself when you hear your name. Commissioner Araceli Campos.
Present.
Commissioner Aziza Hassan.
Present.
Commissioner Helena Marissa Montes.
Present.
Commissioner Megan Ortiz.
Present.
Commissioner Keith Parker.
Present.
Commissioner Abigail Zelensky.
Present.
Thank you, commissioners, and congratulations on your appointment. All 6 commissioners are present. We do have a quorum. I will turn it over to our Executive Director, Capri Maddox.
Thank you, Jumana, and welcome to our commissioners and our city family. I'm very grateful for this opportunity to chair the inaugural meeting of the Civil and Human Rights Commission. I'm very grateful to the mayor and city council for pushing to make sure we were able to have this commission. Particularly, I'd like to thank Councilmember Gil Cedillo, Councilmember Wesson, and the Embrace LA task force that really led to the creation of the Civil and Human Rights Commission so long ago. We know that we had a great deal of support from our community-based organizations, such as the Black Workers Center, UCLA Labor, Commissioner Parker, I can't mess up how I say UCLA. UCLA Labor Center was very instrumental in 2015. The Black Workers Center moved forward to push the agenda for the Civil and Human Rights Commission, and we are very grateful that we are in this current space. As I've said previously, I would not think that we would need a Civil and Human Rights Commission in 2020, but you know, especially with all this going on, we have COVID crisis, the economic crisis, as well as the murder of Mr. Floyd, that have, you know, spurred us to accelerate the opening of the Civil and Human Rights Commission. But the commission in general has been set up to deal with systemic racism and discrimination and to promote equity in so many ways. And we really are going to focus on 4 main topics: the employment, housing, commerce, as well as education. And we have enforcement remedies, and some of which I will talk about now. We have a brief PowerPoint presentation that we will be sure to go over. The one thing that I really wanted to do is to be sure to let people know that we're going to not be standing alone in this journey. We will be leaning in to our partnerships with our community-based organizations, other government entities, and the community at large. And I'd like to thank the community members that are here on the line with us. We will be reaching out to you. We'll be needing your support, and it'll take so much to get us, you know, going to deal with some of the equity issues, particularly some of the systemic equity issues that we've been dealing with. Previously, I've talked about how Black and brown homeowners spend $500 million more per year in mortgage costs compared to whites with the same credit scores. And so we have so many challenges. Of course, they're all around us in education, employment, et cetera. So this commission, I'm very proud to say, is not only going to talk about the issues, we're actually going to be able to have enforcement powers. And that is something that I'm really proud that the city attorney's office, as well as our city council and others, have made sure that we are not just merely making recommendations. We'll do that too, but it's important for us to have enforcement powers, and that seems to get people's attention. The other folks that we'll be leaning into will be service providers and other government entities, such as our legal aid partners and other entities that have jurisdiction in this space, whether it's city, state, or federal. Let's lean in. Can we have the PowerPoint come up on the screen, please? We're going to do a screen share in just a moment, so you can kind of see a visual of what we want to lay out as it relates to the ordinance. And then, of course, we will lean on our commissioners to help shape, guide, and mold us as we move forward with this agenda of justice and equity in the city of Los Angeles. We can, next page, please. So the Civil and Human Rights Commission strives to promote the understanding between and among communities to discourage discrimination that denies the equal treatment of any individual because of an immutable characteristic, real or perceived status. So I want to go to the, are we on that slide? Can you guys see that slide? Okay. I just want to be sure that everyone can see the second page of the slide. Do you see it? As long as you guys see it, it's okay if I don't see it. I have it here. So we'll be collaborating, as I said, with a number of entities, such as the Commission of the Status of Women and the Human Relations Commission, which will also be a part of our team to help us with these missions. Good, thank you. I see it now. We will partner with community-based organizations, as I stated earlier, to enhance diversity and inclusion in our region. And the one thing I wanted to take a moment to talk to you all about is the Office of Racial Equity, which will also be a partner with us. We are so grateful for the opportunity to level the playing field and to apply an equity lens to all things public policy related. We will have the carrot and stick approach of community outreach and engagement to encourage people to live harmoniously and to promote equity in Los Angeles. However, we will have an enforcement arm as well. For the outreach and community engagement, we will alert people to the opportunities to submit complaints, but to deal with it, discrimination awareness training, industry diversity metrics, and that's when we were doing research to take any industry. It could be entertainment, or it could be something in STEM, where we would look at a specific industry and say, how many people of color, what is the representation of that group? And we'll be doing this in partnership with universities that will provide research assistance for us. I want to let you all know that I am very grateful for the support from a number of institutions of higher learning. The thing that I wanted to stress also is upward mobility is really important to our goal and our vision. It's not enough for us to stop discrimination, stop racism, stop hate, but we need to level the playing field by creating opportunities for upward mobility. That would be related to college admission support and job training opportunities, and partnering with existing organizations to buttress their support to empower our communities. And I'd like to talk just for a moment about enforcement and give you a rundown about how things would go. A citizen would come in with a complaint. We plan to have an open space where people can come in from the public can come in to us. We will ultimately be housed at the LA Mall, and people will come and provide information about their complaints through an intake system, and we will investigate the complaints, and we have the opportunity to do a number of things. We have many tools in our tool belt: the letter of concern, mediation, which will be done in partnership with Pepperdine School of Law. It's one of the best mediation programs in the nation, and I'm very grateful for their support to have students support our efforts when it comes to mediation services. Folks will be trained, of course, by city staff, but I'm very, very grateful for the mediation space. And that is where a lot of complaints will end. Sometimes people just need to know that someone's watching, and they can easily correct the behavior. The next thing that I wanted to stress is we have the notice of violations, hearing process, an appeals process. And of course, ultimately for all of these, there is a resolution. So hopefully people can get to the resolution of their issues later. And I'll hold it there. I know we have a few other slides that we can go over. I think we can just look briefly at these next slides that will talk about the 4 areas, the 4 pillars where we actually will have authority and jurisdiction. And that's the review of the 3rd page. So I'll leave it there on the slides, and I think I will turn it over to the commissioners for questions. You can leave it up. Yeah, you can put that down now. Thank you. Commissioners, do we have questions for me? Okay.
Just one question. We'll get a copy of this PowerPoint
You're on
presentation.
mute. Commissioner Parker, you're on mute.
No, I'm not on mute on my side. I'm not showing mute on my side.
I can hear Commissioner Parker.
Okay, I was just saying we will get a copy of the PowerPoint as well.
And it's on the website as well. Yes, Commissioner, and it is on the website as well. So we will get that sent to you. Claudia, can you help me with that? We'll have Claudia send it over to you as well. Thank you, Commissioner.
I have a question. Can you hear me? Can you hear me? Okay.
Commissioner Campos, are you speaking?
Yes. Can you hear me? Okay. Thank you, Executive Director Maddox. This is obviously wonderful, and we can't wait to get started. I heard in your press conference discussion on research as well. Can you tell us a little bit more about that, please? Thank you.
So I'm excited about research opportunities, and I believe that the best disinfectant is sunlight, as they say. And we've been contacted, actually we may have one industry evaluation that may be going on very soon, and I don't want to say which place it is now, but it is of one of our proprietaries, just to, in the city family, again, just to do research on hiring practices, but as it relates to people in entertainment, of course, we know that in entertainment, or if you want to know with technology, where our numbers are, how we're represented, that's very important for us to know. Just say, for example, how many people of color are on Fortune 500 boards, or how many women are in STEM, and we want to talk about maybe specific companies, and I don't want to put any names out there, but if we could just say maybe like Apple or Google or YouTube, and others that are in that industry, what do your numbers look like? How many people do you have in management? How many people do you have that have hiring authority? How many people do you have that are on a pipeline to management? So these are things that are very helpful. And even with some of our private contractors in local government, how many people of color do you have? Someone may be building buildings for the city, for example, and it was always something that was problematic for me to know what do their diversity numbers really look like. And so there are universities that are willing to do studies for us, and I know that someone reached out to me just yesterday from USC, and I think ultimately they may be doing an institute in a space that will be able to help us as well. So we have plenty of universities that want to lean in, and I am very, very grateful for their support. I'm sure we get UCLA involved, and Commissioner Parker as well. Thank you so much for your question, Commissioner Campos. Do we have any other questions?
Yeah. Hi, Executive Director Maddox. This is Abigail Zielinski. So based on the research from the different institutions and universities, will we have any enforcement powers with respect to hiring or basically trying to even the playing field or creating more diversity?
Right. So we have two things. If we have a complaint, there may be some action, and we have jurisdiction. We may have the ability to take action. However, I think that the best resolution that we have after doing the study, for example, would be the bully pulpit, and to make sure that that information, again, sees sunlight and people are aware of the problem. Because I think there's so many companies in town that may be interested in wanting to be clear about their inclusion, their diversity inclusion of programming. But if they look and they see that they're behind others in their respective fields, that may encourage them to improve their stats as it relates to people of color and other underrepresented groups in their field. Thank you so much for your question, Commissioner. Okay, any other questions from commissioners? Commissioner Parker, did you raise your hand?
Yes.
Okay.
You know, I know that there's a requirement in the workplace to have an EEOC poster and a DFEH poster. Will there be a requirement for a poster for our commissioner, for our commission in the workplace as well?
I do not. At this time, we do not. But of course, City Council could make that motion to make that requirement if necessary.
I mean, because the intent of that was so that people knew what their options were and where they could go if they had a complaint they wanted to lodge. So that's why I just raised that.
Okay. So as it relates to whether or not we can have require posting of this ordinance in workplaces, that I did not remember that being in the ordinance. So it's not in the ordinance. I just looked over and checked with legal. We don't believe it's in the ordinance. However, perhaps that's something that City Council may discuss at a later date. Thank you. Thank you. That's a very good question, Commissioner. Any other questions?
Yes, hi, good afternoon. I'm Executive Director Maddox. This is Commissioner Megan Ortiz. Thank you so much for highlighting the work that the Black Worker Center has done in helping this commission be created. Can you talk a little bit more about how we will interact with other enforcement agencies? You know, for example, on areas of wage theft. You know, we know already in the city of LA that there is a Black jobs crisis, you know, with 50% unemployment or underemployment. How would, for example, is there a possibility of joint investigations? What will information sharing look like? Perhaps I'm getting a little bit too much into the weeds, but that's what I'm wondering about.
Okay, no, very good question, Commissioner Ortiz. There are a few things that we plan to do, and some of you know that I'm a former city attorney, and I worked at Zedek Legal Services, a legal aid, legal assistant when I was in law school, and so I understand that space, and I definitely know that we will be moving forward to have an opportunity to do referrals. So I'll give you a quick example. If we have someone to come into our office and they say they were a victim of discrimination or hate, and then they realize, oh my goodness, something happened to you, this is a hate crime, definitely we're going to refer you to the city attorney, district attorney's office. We also may have a case, and like you mentioned, wage theft, for example, we may partner with legal aid, for example, just talking about on a wage theft case. And we may also contact the city attorney's office and use the powers of Business and Profession Code 17200, which would exact larger penalties than we could do here. Our maximum penalties for violations of the Civil and Human Rights ordinance is only $125,000, and for egregious things, especially as relates to violence, would be only $250,000. However, if we know someone's doing wage theft and he's done it for many years, and we would like to bring the case as a Business and Profession 17200 case to the city attorney's office, where they have that jurisdiction, the penalties could be very excessive. I actually happened to work in complex litigation years ago, and I did 17200 cases, and those penalties could go into the tens of millions of dollars. And so I think that we will refer where necessary, and I think it's very important for us to have that power, because we don't want the wrongdoers to know that we only have a ceiling of $250,000 max for like the worst offense. So we may have to use the assistance of our partners, including the AG's office, etc. So thank you so much for that question and for that clarification. Okay. Seeing no further questions, I would like to move on to Jamana to deal with our public comment. Thank you so much. Thank you, Commissioners.
Thank you, Capri. So at this time, we will open it up for public comments. As indicated on the agenda, members of the public who wish to provide written public comments may do so online at civilandhumanrights.lacity.org. Once again, that is civilandhumanrights.lacity.org to submit your comments for the record. Members of the public who wish to offer live audio public comment should call 1-669-254-5252 and use meeting ID number 160-715-5170 and press pound. Press pound again when prompted for participant ID to continue. Once you are in the meeting, press *9 on your phone keypad to request to speak. As soon as you hear someone address you, you are live in the meeting. Once again, that number to call is 1-669-254-5252. Meeting ID number 160-715-5170 and press pound. Press pound again when prompted for participant ID to continue. Once you are in the meeting, press *9 on your phone keypad to request to speak. Please be sure to state the agenda item you wish to speak on. Speakers will have 1 minute for general public comment and 1 minute on single agenda item, or 2 minutes on multiple agenda items, for a maximum of 3 minutes. Please speak to agenda items first. We ask that you stay on topic. Be clear and concise so we can take as many comments as possible. The total time allotted to individuals for public comments may be further limited by the Commission in order to accommodate the number of public comments. If you are speaking off topic, you will get a warning. If you are unable to stay on topic relevant to the Commission meeting, your time will be forfeited. We will take a total of up to 1 hour of public comments. Please be sure to turn down any audio devices you are using to listen to the meeting while you are speaking. There is a time delay between live meetings and the broadcast devices. We're ready to take the first caller.
Please be patient with us. We want to be sure that we do not miss public comment. And I think we have a public comment coming in now.
Caller with the last 3 digits, 469. I am unmuting you now for public comment. Please state your name and what items you'd like to speak on.
Hello, my name is Janelle Bailey, and I would like to give a general comment, please.
I'm sorry, can you repeat what items you'd like to speak on?
May I give a general comment?
Yes, ma'am, you have 1 minute.
All right, hello, everybody. As the director of the LA Black Worker Center that represents hundreds of Black workers and allied Angelenos who've been organizing since 2015 to make this a reality, it's really a glorious day to see this commission have its first meeting. For too long, discrimination has run rampant without repercussion in workplaces across the city, and workers from many walks of life know firsthand that workplace discrimination, whether it's due to race or age or gender or other assumptions around those things, has been a true barrier to good employment that allows people to live in truly happy and safe conditions. It's so wonderful to see our city taking real action and beginning to address some of the root causes of poverty, houselessness, and inequality across the city. Especially during this moment where the coronavirus has deepened crises in our communities, we're going to need this commission more than ever to ensure that all Angelenos share in the prosperity as our economy starts to bounce back. Thank you.
Thank you, caller. Yes.
Once again, we are open for public comments, and I will repeat the number to call if you wish to make public comments. You can call 1-669-254-5252 and use meeting ID number 160-715-5170 and press pound. Press pound again when prompted for participant ID to continue. Once you are in the meeting, press *9 on your phone keypad to request to speak. As soon as you hear someone address you, you are live in the meeting. Please be sure to state the agenda item you wish to speak on. Speakers will have 1 minute for general public comment and 1 minute on a single agenda item or 2 minutes on multiple agenda items for a maximum of 3 minutes. Please speak to agenda items first. We ask that you stay on topic, be clear and concise so we can take as many comments as possible. The total time allotted to an individual for public comment may be further limited by the commission in order to accommodate the number of public comments. If you are speaking off topic, you will get a warning. If you are unable to stay on topic relevant to the commission meeting, your time will be forfeit.
Caller with the last 3 digits, 569. I will unmute your line now for public comment. Please state your name and the agenda items you'd like to speak on.
Good afternoon, commissioners. My name is Lola Smallwood Cuevas, and I'm a project director with the UCLA Labor Center, directing a new initiative called the Center for Racial Equity at Work. The purpose of this initiative is to bring students and scholars and community advocates together to develop strategies that address barriers to Black worker equity in the workplace in Los Angeles County. And I'm so thrilled to hear the voices of this commission today. This is a step in the right direction toward protecting and defending the civil rights of workers and communities of color, and particularly Black people in Los Angeles at this moment. My whole work will continue to focus on the ways in which Black workers experience wage discrimination, workplace discrimination, and terms of access to jobs, but also within work. And I look forward to working with each and every one of you to develop solutions that ensure workers who experience discrimination in the workplace are made whole. We know that the city must work with county and state officials to ensure the protection of workers against explicit and implicit bias, place discrimination, and we look forward to developing the necessary resources that ensure that all workers are protected in our communities. Again, I personally look forward to working with you. You have a tremendous road ahead as you are seeing the racial inequity laid bare in this series of crises that began with homelessness, that took us into COVID-19, and that brought us to the murder of George Floyd. All of these symptoms are rooted in a history of institutionalized racism that has created a level of concentrated poverty in our communities that deny Black workers the opportunity to be able to sustain their families and to protect them in the communities where they live. And your work is so important to getting at that root cause.
Caller, this is a warning. Your time is coming up. Okay.
I want to close by saying thank you, and I look forward to working with you and providing research, labor, and workplace enforcement assistance to ensure that your job is done to the fullest of its ability. Thank you.
Thank you. Caller with the last three digits, 208. I am unmuting you now for public comment. Please state your name and the agenda item you'd like to speak on.
Yeah, my name is Rob Kwan. I'd like to speak on items 2, 5, and general public comment.
Great, you have 3 minutes. Your time starts now.
Thank you for getting this meeting together. It's really great to see this commission up and running, and I was really honored to be alongside the Black Worker Center with a wide coalition and pushing for this effort. And all of the credit in the world goes to the Black Worker Center. We wouldn't have as strong of an ordinance as we do now without them. They not only led the effort, but really turned out a lot of people and engaged them in this process. Since the commission's creation, our biggest concern for people on the outside has been, how enforceable is this ordinance going to be? Is this commission going to have the resources it needs? And unfortunately, it doesn't seem like we do, as is. You've been given a meager budget, and I saw that the director asked for an additional $196,000. And to put that in scale of things and current events as far as what our city prioritizes as far as LAPD's budget, the budget request that you've got for $196,000 is roughly equal to the annual compensation for, the officer that shot Kenneth French at Costco, for Officer Hernandez, who was being prosecuted for beating up a homeless person. That two of them combined make twice that, the rough equivalent of your current budget. So I hope that you are engaged in the current budget process to ensure that you get the resources you need, because unless you have the investigators, unless you actually have the educational campaign to inform people of their rights, this remedy isn't going to mean much. So that's mostly my comment. I just think when it comes to the racial gaps and disparities in this district or in the city, I've always been taken aback by the Chamber of Commerce's annual report, where you can see the disparities in districts. Some of our wealthiest districts have an unemployment rate half that of others. Educational attainment that's about a tenth of other districts. Median income that is less than half of other districts. So, as a city, we face a cross-section of problems that we face as a country. It's good to see that this commission is here. I'm excited to see what comes of it, but I think the biggest thing that we need to see is an investment in resources to make sure that we actually have a meaningful Civil and Human Rights Commission and department. That's all that I got for you. Thank you for your time.
Thank you very much. I'm going to give another 30 seconds for me to see if any more hands are raised. I do not see any more. Oh, I see one. Okay. Okay. Caller with the last 3 digits, 487. I am unmuting you now. Please state your name and the agenda items you'd like to speak on.
Good afternoon, Commissioners. My name is James Wen, and I serve on the Los Angeles Transgender Advisory Council. I am representing myself today. I'm going to be speaking on the agenda item regarding health equity. I'd like to first request that the Commission perhaps assign someone from the Commission to attend the Transgender Advisory Council meetings. Our Transgender Advisory Council staff member is Francisco Ortega. So just connect with him on our next meeting, which has been yet to be scheduled. I would also like to let the Commission know that during the COVID-19 pandemic at its height, that the trans and non-binary community felt that procuring of medical masks for its community was difficult. We do understand that across the board it was difficult for the entire medical community, but in our community especially, where our health centers that do HIV/AIDS testing and also provide services to community members who may not feel comfortable going to a hospital emergency room,
We have a 30-second warning.
Okay, and may want to go to a medical facility, but maybe need a person to go with them, comes to our communities first. And so we just request that PPE for our community is considered and is advocated for. Thank you.
Thank you, caller. I'm going to hold for another 30 seconds to see if I see any more raised hands. Once again, if you're on the line and would like to speak on public comment, please press *9. Oh, I see a couple more hands go up. Caller with the last 3 digits ending in 199. I will unmute you. Please state your name and the agenda items you'd like to speak on. Caller, are you there? 199?
It may be, I don't have a number that shows on my phone. May I speak?
Yes, you'll get 1 minute for general public comments. Go ahead.
General public comment. This is Irene Tovar. I'm speaking on behalf of the Latin American Civic Association of the San Fernando Valley. I want to congratulate each and every one of you commissioners on a very important role that you will play in really addressing the key issues of this 20th year. One of the concerns that I have is that we start dealing directly in terms of the issue of immigration, whether you're a citizen or non-citizen, because citizens are also in a very precarious situation under this federal administration. So I hope you will address that attention as well as all the other things of inequity that exist in this city. Thank you so very much.
Thank you, caller. Next caller, I will unmute number 926. 926, I'm unmuting you now. Please state your name and the agenda item you'd like to speak on.
Hello, this is Justine Gonzalez, former president of the Human Relations Commission. I'm just providing general public comment. I just want to, give my thanks to all the commissioners who have decided to volunteer their time to the city, and congratulate the new executive director of the department, because this is such critical work that needs to be done. It's needed to be done for a long time, and I'm just really excited as an Angelino, as someone who has been engaged at City Hall, to see this come to fruition. And like previous comments have stated, my hope is that the commission and the department can push for further resources, because it's a big city, and you're going to get a lot more to make sure people are, protected, and that we eliminate discrimination in the city. So thank you all.
Thank you, caller. I'm going to wait 20 more seconds to see if I see any other raised hands. Once again, if you'd like to address the commission meeting, please press *9. Okay. We see no more hands raised. We are closing public comments. Thank you all.
Thank you. We will now move to our next agenda item, and that is agenda item number 3, Brown Act overview, and I will turn it over to Kurt Kidder with the City Attorney's Office. Kurt, if you can unmute yourself.
Oh, can you hear me?
Kurt, go ahead. We can hear you.
Yeah, I was going to do it by it might be easier if I do it by my phone. So I'm going to raise my hand on my phone and on the 9956, and
Kurt,
I'll do it by phone.
Kurt, we can hear you. Go ahead.
Oh, okay. So I'm going to pull up my PowerPoint, I hope. Can you hear me?
Yes, we
Hello?
can hear you, Kurt. Go ahead.
Okay. So I'm going to give you a brief overview of the Brown Act. And once again, I'm Curtis Kidder. I'm an assistant city attorney. I'm getting a lot of feedback right now. Okay. So welcome all the commissioners to public service or continued public service. I'm still getting some feedback. I'm going to do it on my computer then. Can you hear me?
We can hear you, Kurt.
Okay. So, okay, so the Brown Act is one
Kurt,
of the...
if you have both your computer and your phone, can you please hang up the phone and just keep the audio from your computer?
Okay.
Or you can
I did
stop
that.
the audio on your computer.
Are we good? Are we good?
Yeah.
Yes, you're good.
Okay. Okay, starting all over. So the Brown Act is one of the statutory schemes that members that serve on commissions will need to follow. It's a rather complex statutory scheme, but I'm going to go through it rather quickly, and there'll be 3 or 4 takeaways for you in your service. And kicking off, there's Ralph Brown. Not too many people know what he looks like. He was Speaker of the Assembly back in the 50s and 60s, and the Brown Act is found in the California Government Code, Section 549050 at SEC, and it was enacted in 1951. The purpose and intent of the Act is that all actions by public agencies be taken in an open and public forum, and also to allow members of the public to address the board on any of the matters that are under the jurisdiction of the board, both items on the agenda and matters of a general interest to that body. So one of the key takeaways is what constitutes a meeting under the Brown Act. And basically it's a congregation of a majority of the members of the legislative body at any time and place to hear, discuss, or deliberate upon any item that is within the subject matter jurisdiction of that body. So what you need to know is the time and place is irrelevant as to whether a meeting is being held or not, as long as a quorum of the body is together discussing an item under the jurisdiction of that body. So that meeting could occur in public, at somebody's house, at a restaurant, wherever. If there is a quorum of the body discussing items of business for the commission, that is a meeting under the Brown Act, and it is subject to the notice and agenda requirements. Now, what you need to know is it also applies to committees of the commission, if there will be any of them, and it also includes serial meetings. Now, serial meetings is the other important takeaway for you. There's basically 2 types of serial meetings, but it's a serial meeting is defined as a communication between members of the commission, each which involves less than a quorum of the commission, but taken as a whole meets the quorum requirement for a meeting. Now, as I said, there's 2 types of meetings, serial meetings. One is the chain, where commissioners basically, Commissioner A talks with Commissioner B, who talks with Commissioner C, until a quorum of the commission is reached. So that if this is a 5-member commission, if 3 of the members engage in this chain conversation about an item under the jurisdiction of the commission, then that constitutes a meeting and subject to the notice and agenda requirements of the Brown Act. The other type of meeting is the hub and spoke, where one commissioner contacts Commissioners B and C, so that you then reach a quorum of the board that way, and they basically exchange or deliberate on an item under the jurisdiction of the commission. So those are the 2 types of serial meetings. You have to be really careful of those. Those can occur through intermediaries, your staff, on emails, on texts, on chat rooms, Facebook, what have you. If the basic rule is if there is a quorum of the commission discussing an item of commission business at any time, in any place, in any manner, that constitutes a meeting and requires an agenda and a notice of that meeting. Here's some more information on serial meetings. One thing that happens on occasion is that board members will be briefed by the general manager of the commission. And that's now allowed under the Brown Act, as long as the general manager who is contacting each of the commissioners does not share the comments of the other commissioners with the commissioner they're talking with. So that the staff can talk with a quorum of the commission, as long as it does not substitute for a deliberation of the commission. That is, there's no sharing of other commissioner comments. There's also a new briefing allowed under the COVID-19, the governor's emergency declaration, which does allow for a full briefing of commissioners by the CEO or staff on COVID-19 related matters. So that's a new exception to the Brown Act prohibition on serial meetings. One thing that's not a serial meeting is a discussion for times and dates for meetings, so that a quorum of the board could discuss, the date of the next meeting and topics for that meeting. That is not considered a serial meeting. As most of you know, there's 3 types of meetings under the Brown Act. There's a regular meeting, a special meeting, and an emergency meeting. Your regular meeting is set by an ordinance or a resolution, or for this commission, will probably be set by your bylaws. You identify the day you're going to meet, the time, and the location of your meeting. From then on out, all the meetings of the commission that are held at that time are regular meetings and subject to the 72-hour notice and agenda requirement. The second type of meeting is special meetings. Those are occasional, and they're called as needed, and typically they're used for workshops or things that require special attention by the commission. Not a lot of guidance on special meetings in the Brown Act, but they only require 24 hours notice and the posting of an agenda. And then you've got your emergency meetings, and those are called in response to a disaster or some calamity, and like an earthquake or a fire or something like that, a pandemic perhaps. Those only require telephonic notice to media outlets with no specific time for that notice. Let's see, oops. So the types of meetings that the Brown Act applies to, it applies to retreats and workshops conducted by legislative body. Like I said, those informal gatherings of the body where agency business is discussed. Advisory committees that are created by formal action of the body. There's your serial meetings, and then your standing committees. The Brown Act also applies to video teleconferencing and audio teleconferencing, as we're doing today. The Brown Act has a number of requirements for teleconference meetings that have been relaxed by the governor, but under the old rules, you had to have notice of the remote locations on your agenda, and you had to post the agenda at all of the remote locations. The public needed access, or was allowed access to those remote locations. Form of the members have to participate within the jurisdiction of the commission.
Kurt, your audio is breaking up.
The city of Los Angeles.
Kurt, can you hear me? This is Romana.
And it does allow for folks to participate from jurisdictions. Hello? Should I call in by phone? Hello? Can you hear me? Hello? Hello? Hello?
I hear you. I feel like the sound is better now.
Can you hear me?
Yes.
Okay, good. Let me go back. Yeah, so just going over the teleconferencing meetings again. So as I said, the governor has relaxed a number of the.
Kurt, can you hear me? This is Romana.
Yeah, I can hear you. Can you hear me? I can call in. I will try and call in again. Oops. I'm calling in.
All right, Kurt, thank you.
Can you hear me?
Yes.
Okay, let me go back. As I said, the governor has relaxed a number of the requirements for holding teleconference meetings as a response to the COVID-19 pandemic. So now you can hold these teleconferencing meetings as a fully virtual board meeting. That means that there doesn't have to be a physical location for the meeting to actually occur. And he's also waived the requirements for including the remote locations on the agenda or posting the agenda at the remote locations. The remote locations do not need to be AD accessible. Whoops. A quorum of the board need not be present within the jurisdiction of the commission, jurisdictional limits of the city of Los Angeles. You have to have a process to allow members of the public to address the board and to resolve issues regarding accommodations for disabled folks. And an existing requirement under the Brown Act requires that all votes on actions taken at a teleconference or a video conference need to be done by roll call vote. So if you take okay, what's not a meeting under the Brown Act? It's individual contact, less than a quorum of the commission or a committee, conferences and community meetings and meetings of other agencies, but you need to be aware that at those types of events, members of the board cannot sit together and discuss items under the jurisdiction of the commission. You just need to be careful about that. Same with social or ceremonial events. A quorum of the board can attend those together, but you can't discuss items under the jurisdiction of the commission. Ad hoc advisory committees, if you're going to form any of those. And then here's your meetings with agency staff, as long as there's no consensus building through that meeting process. Okay, then your agenda requirements. They will need to know all these items. I'm sure they do, but basically you need to identify the time and location of the meeting. You have to briefly describe each of the item of business to be discussed at the meeting. The Attorney General advises that it can be 20 words or less, but it must inform a reasonable person on matters to be discussed and the action to be taken. Reading the description would be informed to call in or attend the meeting to provide a comment on that item. Matters on the agenda that can be discussed. So you've got your agenda and an item comes up after you posted your agenda. There is a way that can be added to the agenda at the meeting, and it applies mostly to emergency items that come up after the agenda is posted, and if it's action's not taken on that at the meeting, there'll be some prejudice to the commission, and you have to take a supermajority vote to add that to the agenda. Other things that you can discuss that aren't on the agenda are commendations and setting of meeting times and future agenda topics. You need to post your notes and agenda on your internet website if you have. Still hear me?
So Kurt, we're having
Monica, can you still hear me?
your audio is a bit
Hello?
choppy. So I just want to flag that we just wanted a quick overview. We will have a full training at a future date. And so it would just a quick an overview of top level. So your audio is chopping, just cutting off a little bit. I just wanted to make sure I flagged that for you.
Okay, can you hear me?
Yes, we could hear you.
Can you still hear me? Okay, I'm just briefly going to go through these items. There's really only one other takeaway I wanted to present. And closed sessions, it has to do with a citizen's right to address the commission. And of course, members of the public are entitled to address the commission on any agenda item or any matter within the jurisdiction of the commission. And the commission cannot prohibit a member of the public from criticizing the commission, its policies or procedures. The commission can, however, prohibit conduct that actually disrupts the meeting. And as you probably know, this is a big issue at the city council meeting. There's a handful of folks who are bent on disrupting the meetings of the city council. So that the person who's disrupting the meeting should be warned first about the disruption. And then in order to have them leave the meeting, there actually has to be a disruption of the meeting. But people get kicked out of the council meetings all the time for disruptions. If there's a group in the meeting that is making it impossible to conduct your business, the commission can have the audience removed from the meeting and conduct the meeting without members of the public, but members of the press are allowed to stay. So those were the three the board, and here's the violations of the Brown Act. There is intent to deprive members of the public the opportunity or Brown Act violations, such as you didn't properly agendize an item under the standards set by the Attorney General, a member of the public can submit a notice to cure letter to the commission identifying the alleged Brown Act violation. For that violation, typically they will re-agendize the item and hear the item again at the next commission meeting. And if they do that, then the member of the public is prohibited from filing a court action. If the commission doesn't correct the action and the person does file an action in superior court and prevails, they are entitled to an award of attorney's fees and costs, and they can be quite high in Brown Act violation cases. Oftentimes they can reach 6 figures. So that's sort of the big impetus to follow the provisions of the Brown Act. And those were the points I wanted to hit. I can open it for questions if there are any of those from the commissioners.
Thank you, Kurt. Commissioners, if any of you have any questions for Kurt, as I mentioned, we will have a full training on the Brown Act at a future date. But if you have any questions for Kurt at the moment, please feel free to unmute yourself and ask your question.
Doesn't sound like it.
All right, so unless there are any questions, we will go ahead and move to agenda item number 4, discussion and action items. And before we move into that, Kurt, if you could give us a very quick snippet overview of Robert's rules for the commission. So Kurt, it looks like we lost you. We'll just give it another minute.
Yeah, so this is how you run. A lot of public agencies use, but hello?
Kurt, we're having trouble with your audio. Can you try the audio from your phone device instead of your computer?
Okay.
Thank you, Kurt.
Let's see. Okay, I just called in.
Great, we can hear you. Can you
hear me on the computer?
We can hear you. Can you dial *9?
Okay, well, I'm getting feedback on my phone.
Try to do *9 on your phone so that we can help with the audio on our end.
Whoa, whoa, whoa.
Can you turn the volume on your computer down and only leave the audio on your phone?
Okay, how's that?
Much better, thank you.
Okay, boy, figuring out the technology. Okay, so on Robert's rules, you're not required to follow Robert's rules, and some agencies do follow them and others don't. The thing about Robert's rules is they're a little formalistic, and what you can do is follow some parliamentary procedure and use Robert's rules as a guide. But generally, how it works is you need to take action by motion. So any member of the commission can make a motion, and any member can second the motion. You then should have discussion on the motion. And then in order for an action to be taken under the city's administrative code, you need to have a
majority of the full membership of the commission. So if it's a 5-member commission, you have to have 3 members of the commission vote yes in order for an action to be taken, sort of regardless of the number of commissioners who are at the meeting. So if you have 3 commissioners at the meeting, it would require a unanimous vote to take action under the city's administrative code. And you need to know that folks who abstain, abstentions are viewed as yes votes under the administrative code. So, so when an item comes up for consideration, you kind of have some discretion on how you handle it. Some people like to have the staff report go first, or have the public speakers go first, and then have commission discussion. But you can kind of feel your way a little bit on that. You have discretion on exactly how that order's taken. After you have your public comment and your staff presentation, you can then have a board discussion of the item. And then at some point, either you need to cut off discussion, or somebody can make a motion to take a particular action on the item under consideration. You need to understand that that action needs to be agendized, needs to be an item of business on your agenda. So like I said, once a motion is made by any member of the commission, it needs to be seconded by any member of the commission. Once it's been seconded, there can be then an additional discussion by the commission on the actual motion. You then want to close the discussion, and a commissioner can actually make a motion to close discussion and call the vote. It's a little bit formalistic, but that's under Robert's rules. Once the, as I said, once the motion has been called, then a vote of the membership, and as we know for teleconference meetings, that needs to be a roll call vote. At an actual in-person meeting, it does not need to be a roll call vote. It can be a show of hands or just a voice vote. And if the motion does not pass, then basically it can come back at a future meeting. If it does pass, you can then it goes into effect. I believe there's a 5-day waiting period for the council to take jurisdiction over it under Charter Section 245. If the council does not take jurisdiction over it, then it becomes a final action. If the council does take jurisdiction over the matter, they can only veto the action taken by the commission and then return it to the commission for further action. Let me see. If the commission takes an action or does not take an action on an item at the commission meeting, it can later at that same meeting reconsider the item through a motion for reconsideration. That has to be made by a member of one of the commissioners who voted on the prevailing side of that motion. So if the motion passed, it has to be somebody who voted in favor of it. And if it failed, it has to be a member who voted against it. The motion for consideration then needs to be acted upon by the commission as to whether they want to reconsider their previous action on that item. If that motion passes, then the commission can then discuss a new action, either an amending action or a vote the other way on the original motion. And then you treat it just as a regular item of business before the board, subject to discussion and motions and seconds and another action. Those are kind of the basic ground rules for the meeting. They're, of course, under Robert's rules, there's lots of other types of motions and parliamentary actions that don't come up very often at our meetings at the city. But I think kind of the key is you don't want your parliamentary procedure to get in the way of taking action and moving items through the board process. So that's a general overview.
Great, thank you so much, Kurt. It's much appreciated. If it's okay, we will hold questions and discussion. We are going to need to move to our next agenda item, and we will come back to this agenda item but we will need to move to presentations just to make sure that our presenter has an opportunity to present before the committee. And at this time, I'd like to turn it over to Capri Maddox.
Thank you, Jumana. Thank you, Kirk. Really appreciate your presentation. Our next agenda item is a verbal report on the health impacts of systemic racism as relates to underrepresented communities related to the COVID-19 crisis and other health disparities. We are thrilled today to have Dr. Chandra Ford, she's an Associate Professor of Community Health Sciences and Founding Director of the Center for the Study of Racism, Social Justice, and Health. Prior to joining UCLA, she completed postdoctoral training in social medicine at the University of North Carolina at Chapel Hill and epidemiology at Columbia University at the Moment School of Public Health. And that's where she served as a WK Fellow, WK Kellogg Foundation, Kellogg Health Scholar. Overall, Dr. Ford's research examines relationships between racism and those racism-related factors and disparities in the HIV care continuum. And she also advances the conceptual and methodological tools to study racism's relationships to health disparities. I am so pleased and grateful to have Dr. Chandra Ford join us today. She is a leader in this field and someone that we really would like you to have join us. Thank you so much for being our inaugural presenter for the Civil and Human Rights Commission.
Thank you very much for having me.
Dr. Ford, go ahead. We can hear you.
Okay, well, thank you, Executive Director Capri Maddox, and also commissioners for the opportunity to share remarks with you this afternoon. I am Associate Professor of Community Health Sciences in the Fielding School of Public Health at UCLA and Founding Director of the Center for the Study of Racism, Social Justice, and Health. For more than a decade, I've been teaching and conducting research on the health implications of racism and other social inequalities, for instance, homophobia, and working to develop the theory and research approaches that are needed to improve the rigor with which researchers study health inequities. The Center for the Study of Racism, Social Justice, and Health was launched on October 9th, 2017, as you all know, the inaugural Indigenous Peoples Day in Los Angeles, in order to bring together experts who are studying the health and healthcare implications of various forms of oppression, including anti-Black racism, nativism, anti-immigrant sentiment, discrimination on the basis of religion, such as anti-Muslim racism and Islamophobia and anti-Semitism, and other forms of social injustice. Much of the information I will share with you today is based on a book that we published in August 2019 by APHA Press. And I'm going to see if I can share slides here. So the book on the left, much of the information I'll share with you today is based on Racism, Science, and Tools for the Public Health Professional, which was published in 2019, and also on a resource published by the National Academies of Sciences, Engineering, and Medicine, the Communities and Action Pathways to Health Equity, which was part of a consensus study on community-based solutions to promote health equity.
The center launched the COVID Task Force on Racism and Equity on March 16th of this year. It's based in the Fielding School of Public Health at UCLA, and it's co-chaired by myself and Dr. Bita Amani of Charles R. Drew University. This collaborative endeavor is one that we hope to build on between the two institutions.
Are you still sharing your screen with us?
No, I'm sorry, I'm not. Let's see, can you? You should be seeing me though. Okay, great. So I was asked to speak today about systemic racism. I will use the term structural racism and inequities in the COVID-19 pandemic. Over the last 2 decades, more than 1,000 studies have been conducted within the field of public health that examine the relationship between racism and disparities in health, as well as disparities within the healthcare system among diverse populations. The commission and the department are to be commended for allowing some of this research to be tapped into in order to inform the work that you all must do. Obviously, it's not possible to cover either topic comprehensively in the time available to us today, so I'll highlight just a few concerns, and I'll certainly be available after this meeting to provide additional information. And I hope that some of the recommendations that I am able to share with you, that we'll have time to talk about them. Okay. Doing this by Zoom is a new experience, so please bear with me here. In the current era where overt forms of racism that we associate with the US South, things like waving Confederate flag, Confederate monuments, and other overt forms of racism, white supremacists marching in the streets. Those forms of racism make it easy to point to, for instance, the US South as a place where racism exists. But for those of us who work on what some call, quote unquote, the left coast, it's important and helpful to think about the ways in which racism operates here. And one way I like to start many of my talks on the West Coast is by highlighting the levels of hate crimes on the West Coast in California and here in Los Angeles during the period when many pundits in our country were actually describing the nation as, quote unquote, post-racial. And here we have data from 2005 to 2015 in Los Angeles that show that, first of all, that show the groups who are most subject to hate, who experienced the most numbers of hate crimes during that period. What we see is that Blacks, who are on the top blue line, lesbian, gay, bisexual, and transgender persons, as well as Jewish persons and Latina persons, experienced the highest numbers of hate crimes during that period. What's interesting is that there's a decrease over time. In 2014, nationally, as well as in California, these rates actually start to go up. And if you look at more recent data, the rates of hate crimes actually continue to increase sharply. So this is important to think about because hate crimes represent some of the most egregious forms of racism that people experience. And even in places where we identify as liberal, the most egregious forms of hate crimes still occur. And this occurs in places where there are high proportions of racial and ethnic minority populations. So that does not prevent the occurrence of racism. So as of yesterday, June 11th, 2020, 68,875 cases of COVID-19 had been diagnosed and 2,813 deaths had been recorded in LA County. In LA, as around the world, around the nation, stark inequities exist by race and ethnicity. As of June 3rd, 2020, the UCLA Center for Health Policy Research determined that 24% of COVID-19 deaths in the US, that's more than 21,000 people, those deaths occurred among Black people, if we only count the deaths where the race of the person who died was known. And this is true even though Black people make up only about 13% of the US population. In LA County, as of June 5th, 29 out of every 100,000 Latinos, 31 out of every 100,000 African Americans, and 31 out of every 100,000 Pacific Islanders have died of COVID-19, compared to 15 out of 100,000 white people. So given the salience of racism, prevention efforts can be considered to have focused rather narrowly on the virus itself without considering the ways that the virus travels across populations that experience a variety of social inequalities. As a result, it is likely that the COVID-19 pandemic will continue to exist in pockets of our society that are overlooked because of their marginalization. And to the extent that it does, it's likely to lead to more extended and complex epidemic, especially among the most vulnerable members of our society, including racial and ethnic minority populations. So the problem is not simply that this virus exists. The problem is its transmission occurs among people, and it spreads along the lines of inequalities that already exist in our society. As the science on racism as a public health risk factor clearly shows, disparities will expand or worsen unless the underlying inequalities are addressed. And these inequalities are due in part to higher rates of certain underlying chronic conditions, especially in Black and Brown communities and in indigenous communities. But it's important to shift the focus so that it does not focus merely on noting that individuals with certain underlying conditions have higher risk. The more comprehensive strategy should address the reason for the underlying social inequalities. Because as long as those reasons exist, those underlying disparities in the chronic conditions will continue to get generated. And there will always be higher numbers of individuals in certain communities who end up having the underlying conditions. A caution I would offer there is that it's possible to end up thinking it's something about the race or ethnicity of these communities. The more important thing is to think about how people of these communities are treated in part because of their race or ethnicity. Unfortunately, however, relatively little attention is given to identifying and addressing the root causes of these underlying conditions. So the emergence of overt forms of racism, as I mentioned earlier, are only one piece of the story. It's important to note that were we to have more precise data on the nature of hate crimes during the COVID pandemic, we would see upticks, no doubt, among Asian populations. However, it is racism as defined by former president of the American Public Health Association, Kamara Jones, as a system of structuring inequality that assigns value based on the social interpretation of how one looks. And it's that how one looks that we call race. And this system unfairly disadvantages some individuals and some communities, while unfairly advantaging other individuals and communities. And it's this process of unfairly advantaging and disadvantaging that actually saps the strength of the whole society through the waste of human resources. That's racism in general. Structural racism can be defined as the totality of ways that systems in society, so for instance, the financing system, employment systems, healthcare, housing, differentially treat groups based on their race or ethnicity. The apparent racial differences that result are often used to justify continuing to treat those groups differently. And for this reason, it's important to focus not on the race or ethnicity of groups. So trying to understand, for instance, what is it about Black people that leads them to have high risk behaviors? Rather, what is it about the treatment that Black people are receiving that leads them to be at risk for COVID, hospitalization, or death? So in 2017, the National Academies published the consensus study I mentioned earlier. That report, entitled Communities in Action: Pathways to Health Equity, found that community-wide investments to address the social determinants of health are essential if communities are to achieve health equity. Importantly, it recognized the private sector as one piece of the puzzle in achieving community-wide health equity. According to the report, the private sector, as well as other sectors of the community, must play a role as an anchor organization that works in equitable partnership with communities in order to achieve equity. With respect to the COVID pandemic, the growing evidence of disparities has helped raise awareness about the need to ensure equity in testing in order to diagnose and identify cases of COVID infection. However, it's important to ensure that equity occurs across every stage of the care continuum. And I use this term, the care continuum, to highlight each of the stages that a person must engage with the healthcare system at. So these might include getting tested, getting the test results in a timely fashion. For those who are positive, who test positive, getting linked to the appropriate care, remaining in care, and adhering to the medication and other prescriptions that the patient receives or that are recommended. Disparities based on the timeliness, aggressiveness of treatment options, or the quality of services may occur at each of these points. And this is significant because we don't have a lot of data to monitor what happens inside the healthcare system at each of these stages with respect to equity. Structural racism operates within the healthcare system, and so the focus simply on diagnosis and access to healthcare does not address this, which is the ways in which once inside the healthcare system, people of color, in particular Black patients, do not receive the same level of care in most instances, and this is across health conditions. Therefore, having access to healthcare, though important, does not address this differential treatment patients receive within the healthcare system. In general, implicit biases, which reflect embedded institutional policies and practices, lead to systematic differences in how quickly racial and ethnic minority patients receive care, how aggressively their healthcare needs are treated. But it's important to keep in mind that implicit biases are not random individual perceptions. They reflect institutional and societal policies and practices. This explains why implicit biases are largely predictable. With an infectious condition such as COVID-19, the implications of unfair treatment within the healthcare system exist not only for an individual patient, but also for those family members and loved ones with whom that patient interacts. There are numerous studies documenting that racism, anti-immigrant sentiment, and racial scapegoating facilitate, the way they work is by facilitating the dismissal of the health concerns and perspectives of patients and of undocumented immigrants, racial and ethnic minorities, incarcerated persons, people living on reservations, as well as poor people and others. And so that's one of the mechanisms that thinking about how structural racism operates within institutional settings, even within the healthcare setting, that disparities in the long-term consequences of initial infection might arise. While much attention is focused nationally on the development of a vaccine, the mere existence of treatment or vaccine does not mean that disparities will be eliminated. The evidence from the HIV epidemic actually suggests the opposite. Disparities are likely to be exacerbated if any treatments or solutions that become available are made available without addressing the inequities and the social determinants of health that already exist in society. So with HIV, although African Americans had experienced higher rates of AIDS than their proportion of the population would suggest, since the beginning of the epidemic, it was in 1996 when antiretroviral therapies became widely available, and these are the life-saving HIV medications. Upon their introduction, the magnitude of AIDS, which was then an end-stage condition of HIV disease, that disparity actually worsened and grew. And the difference between the percentages of AIDS cases among African Americans and whites, that's the point when we're looking over time that African Americans surpassed whites in accounting for a greater share of AIDS diagnoses. Ironically, instead of reducing the Black-white differential in AIDS, as one might expect, the availability of these life-saving medications actually appears to have exacerbated them. With respect to COVID-19, concerns also exist about the labor implications for communities of color who work proximally to COVID-19. For instance, data from the US Bureau of Labor Statistics for the nation indicate that in 2019, Black and Latino workers worked in occupations that placed them on the front line of the COVID-19 pandemic, including 18.2% of all janitors in the US are African American, 31.6% Latino. These numbers likely undercount undocumented persons. 27.5% of licensed practical and licensed vocational nurses are Black, 37.2% and 17.6% respectively of nursing, psychiatric, and home health aides are Black and Latino respectively. It's important then that businesses, including healthcare organizations, be required to protect the well-being of workers such as these, and that policies and enforcement strategies be put in place to ensure their well-being. I'm optimistic about the possibility of addressing the ways that racism contributes to health disparities in general and how it may actually exacerbate COVID-19 disparities over time. One example of a possible solution comes from a recent study led by my late colleague, Billy Cunningham. This pertains to HIV treatment. Previously, researchers had established that among patients who are in HIV care, Black patients who are seen by white providers are given prescriptions for the life-saving antiretroviral therapy medications later in the course of disease than their white counterparts. That is, among patients seen by white providers, Black patients get access to the life-saving medications later than white patients do who are at the same stage of disease. In this most recent study, the purpose of the study was to see if by improving the communication process essentially between the healthcare provider and the lab that conducts the tests and so forth that are necessary in the patient's as indicated in the patient's medical record, if by improving communication between the lab and the provider, some of those disparities might be reduced. The findings were really exciting because the study found that by using the system, the disparities were, the system helped to automate the services that were provided. And the study found that by using the system, that disparities were eliminated, but also that improvements were made for all patients. And this is notable because many of the studies that we do to address disparities are developed based on approaches that are specific to disparities. Whereas interventions that we develop to address the needs of the overall population are addressed specific to the overall population. This study managed to make improvements both for the most vulnerable communities and for the overall patient population. So it's a win-win for all. And I think that kind of project can be a model for how we can think about making improvements within the healthcare system in general that also benefit everyone, and it doesn't feel like a loss to any one particular group. Based on how the social determinants of health work and how structural racism operates as a fundamental cause of health, and by fundamental cause, what I mean is that even if we address some of the more immediate ways in which factors influence health, a fundamental cause is so influential and dominant in our society that it will actually regenerate those conditions of, for instance, extreme poverty that lead to regenerating the disparities. And so it's important, knowing that structural racism is a fundamental cause, to identify ways to target structural racism, not just the intermediates between structural racism and the COVID-19 outcomes or other outcomes that are most apparent.
Thank you. Thank you so much, Dr. Ford. Commissioners, do you have any questions at this time? Dr. Ford, I only have a few minutes before her next presentation. Commissioners?
Hi, Dr. Ford. Can I ask a question, Commissioner Ortiz?
Certainly.
Thank you so much, first of all, Dr. Ford, for this really great presentation. I think it lays bare lots of what I've been seeing in the communities, working specifically with day laborers and domestic workers. Can you talk a little bit if the study also looks at the influence, especially in Los Angeles, of geography? We know that especially sort of the issue of urban planning, if you will, and how neighborhoods were developed in the city, including the lack of community clinics in certain communities. Is that also part of the study? And I look forward to reading it more deeply. So excuse me if it's embedded in all that juicy data.
So that is not a part of that study, but is certainly a part of many studies that people have done, including a huge study looking at the color of wealth in Los Angeles. And so we were really delighted that Charles R. Drew University started doing testing, for instance, around COVID-19, because of the fact that we can't really distinguish the racial and ethnic from socioeconomic forms of segregation that pervade Los Angeles. So as I see it, we do need to have an intersectional approach to addressing this, one that recognizes that the socioeconomic, racial, ethnic, geographic, and even gendered, and we could think about other dimensions as well, are inherently tied in ways that are exacerbating the risks and the possibility of doing well in spite of this pandemic. So that's an important set of questions, and any effort to understand and address structural racism's effects on health in Los Angeles or elsewhere, but particularly in Los Angeles, must account for the segregation of neighborhoods in Los Angeles.
Dr.
Yes.
Ford, I have a question. Given, I mean, the data you shared is fascinating, and I too would like, to look at it in more depth. But some of the things you were saying about the disparities around COVID-19, really touched me, given my age. And as I think about any dissemination of a vaccine, what early recommendations will you or School of Public Health or public health practitioners, what kinds of recommendations can you begin to make to the LA Department of Public Health to address some of these disparities and have them start to plan, to mitigate the disparities so that there is some kind of sensible dissemination of whatever vaccine gets developed? What will be criterias? What will be standards? I mean, how will we do this in a fair way? Is there a fair way?
What an important and wonderful question. Thank you for it. First of all, the studies have to be done among diverse populations. It's not enough to do them in select populations. So diverse communities have to be involved in the research that's happening. And that research needs to be monitored to make sure that it's of the highest quality in terms of ethics. When it comes to uptake of the vaccines that hopefully will become available at some point, I think it's important to keep in mind that in thinking about structural racism, let's assume that there are no bad actors and there are no reasons for people to distrust public health messages or political messages about the pandemic. I didn't talk about this earlier, but one of my concerns is the ways in which conspiracy beliefs evolve and emerge. There are two general types. There are those that are sort of the science denialism, and we see a lot of those with the climate denialism and so forth. I'm not talking about those right now. I'm talking about the forms of conspiracy beliefs that arise out of people's experience with mistrust and medical racism in their communities. So these are legitimate concerns that people have about being excluded and also about being treated unfairly within the healthcare system. And so one of my concerns is if we do not address the underlying inequalities in the COVID that are showing up in the COVID pandemic, that what we will see is pockets of persistent COVID-19 infections that may look to people like there is an intentional reason to distrust, when in fact the inequalities themselves are so stark that people don't need to do anything intentional in order for there to be persistent disparities. However, some folks might actually begin to distrust more when it comes to vaccines because they feel like they're not sure why particular communities appear to be targeted for higher rates of disease. So I think that in order for there to be uptake of the vaccines when they become available, we have to do the work now. And that work needs to involve making sure that all the resources that are available for prevention are distributed equitably. And by that, I mean that in the most vulnerable communities, the most resources are dedicated. It cannot be the same resources, it cannot be simply that more of the same resources given in areas where there's more need. Each community needs to have its own tailored strategy. In communities that are highly vulnerable, when we think intersectionally, what that means is they're dealing with much more complex issues. And so we have to deal with the full complexity of it. Otherwise, the rates of disease will persist. So to circle back to your question, I think that for me, we need to start thinking about the long game now. And part of that is to think about how do we get people not only to get the testing they need and to participate and to take part in the prevention efforts that we now recommend, but also how do we ensure that they trust us enough to know that when vaccines become available, they will be available in our communities, that the vaccines are safe, that they trust the messengers. These are things we should be thinking about now.
Thank you so much, Dr. Ford. Any other questions, commissioners? I think Dr. Ford actually has to go to her next presentation at 4 o'clock. Seeing none, thank you so much, Dr. Ford. We really appreciate your work. We appreciate you being here with us today, especially on such short notice. And we wish you well in all that you do. Thank you.
Thank you all very much.
Okay. Good luck with your next presentation as well. Commissioners, I would like to go back to item number 4, and we have consideration and temporary adoption of Robert's Rules. I would like to ask for, and I'd like to also thank Kirk Kidder from the City Attorney's Office for his presentation, but I would like to ask for a motion for consideration and temporary adoption of Robert's Rules. Once the motion is called and seconded, a vote will be taken, and the commissioners' names will be called to speak, do a speak vote for the record. Do you all have anything that you'd like to share on that point?
Before a motion, can I ask, there, it says other commissions actually have or don't necessarily follow Robert's Rule. Do they follow?
So there's some other commissions that actually have bylaws, and this commission, I believe, will have the ability to have bylaws, and I will be asking in the next vote to see if we can have an opportunity for us to have an ad hoc committee that'll help us prepare our bylaws.
Thanks. I motion to move on Robert's Rules or adopting them.
Yeah, it's just temporary, Commissioner Hassan. So you move, okay? Is there a second?
I second. Before we vote, you said it's going to be temporary, so how long would it be until we have the bylaws in place?
Yes, and the next item that we will be discussing is the creation of the bylaws, and I'll be asking for an ad hoc committee to be created with 3 members. So this will just be temporary until we get our bylaws. We're expecting no more than a couple of months. Thank you, Commissioner. Did we get a second?
I said I'll second.
Okay. Thank you. I think we got a second. Moana?
Right, so Commissioners, as I read your name, just state your vote for the record. Commissioner Araceli Campos.
Aye. Did you hear me?
Sorry, I didn't hear that. Thank you.
Aye. Yes.
Commissioner Aziza Hassan.
Yes. Yes, did you hear me? Yes,
Yes,
I've been in
thank you.
favor. Thanks.
Thank you, Commissioner. Commissioner Helena Marissa Montes.
Yes.
Commissioner Megan Ortiz.
Aye.
Commissioner Keith Parker.
Aye.
Commissioner Abigail Zelensky.
Aye.
Thank you, Commissioners. Motion passes, all voting in favor.
Thank you, Jumana. As I mentioned earlier, Commissioners, you are a newly created commission, and we will need to create an ad hoc committee to develop the bylaws. The committee will work with our staff and also the City Attorney's Office to draft the bylaws for review and consideration by the full commission at the next meeting. The committee must not exceed 3 members of the commission as required by the Brown Act. Would any of you be interested in serving on this committee?
Me.
Yeah, I see 2 eager hands.
I'm happy to volunteer as well.
Okay, thank you, Commissioner Montes. Okay, so we have 3 commissioners that are interested in participating on the bylaw committee, and we really appreciate that. And we want to thank the city attorney's office in advance for their support as we create bylaws.
So this is Jumana. Just to confirm, I have Commissioner Araceli Campos,
Yes.
Commissioner Helena Marissa Montes, and was it Commissioner Ortiz? I'm sorry, Commissioner Abigail Zelensky?
Yes.
Great. So we can ask for a motion
We can have a motion to create the bylaws, drafting the ad hoc committee.
I so move.
Okay.
Megan Ortiz seconds.
Seconded by Commissioner Ortiz. Jumana, would you like to read the names for the vote?
Sure. Commissioner Araceli Campos?
Aye.
Commissioner Aziza Hassan?
Aye.
Commissioner Helena Marissa Montes?
Aye.
Commissioner Megan Ortiz?
Aye.
Commissioner Keith Parker?
Aye.
Commissioner Abigail Zelensky?
Aye.
All voting in favor, motion passes.
Director Maddox, could you speak a little louder into your microphone? I'm having a hard time hearing you sometimes.
Did you say it to me? Yes, I actually didn't turn my volume off at that moment, so thank you so much for alerting me. So I think that we really appreciate everyone being here today, and I would like to know if we don't have any other items on the agenda. And Jumana, I can turn it over to you if we're ready to to see if we can adjourn the meeting at this time.
Thank you, Commissioners. Unless there are any final thoughts or questions for the Executive Director, we can go ahead and adjourn the meeting. Are there any questions at this time?
Is there
Aye. Go ahead.
Is there an item about the next meeting that we should address?
Sure.
Yes, we were in discussions to see if we could actually meet next month. We're looking at a month from now on the same Friday. I believe we had one commissioner that was not able to meet at 10 o'clock. I know some commissioners were interested in meeting at 10 o'clock. This time is fine for us at 2, but depending on how long these meetings could go, it could really take us into the evening hours, which is fine for us. But I just wanted to alert you to the fact that we may have meetings that may last, 4 or 5 hours. And I want to be sure that we have enough time in the day for people that have childcare or other obligations in the evening. So would you all like to actually meet at 10 o'clock or 2 o'clock on Fridays? Again, we're flexible. The other thing that you should be aware of is that City Council actually has meetings at 10 o'clock on Fridays as well. So that would preclude us from being a part of a City Council meeting. If we had an item that needed to be there, we would have to do another day. So we're really flexible. You all can think about it. I believe Jumana or Claudia will follow up with you, but if we want to make a decision now, I'm fine to do that. And then the date for that would be 1 month from now, actually on a Friday, so it'd be 4 Fridays from now. Could we get the bylaws done by then? Yeah. So it would be July the 10th or 17th. Do you have any opinions?
I already have, I'm unavailable on July 10th. I'm available on July 17th.
Okay. Okay, thank you so much, Commissioner Zelinski. I believe that Jamana will follow up with the commissioners on the date, and we will have a date, but it looks like it'll be the 17th. Are all the commissioners available on the 17th? Are you able to check that now? Okay, good.
Yes.
Would we opt for a 10 o'clock or a 2 o'clock meeting for our next meeting?
I prefer.
Someone said, Commissioner Zelinski, can you repeat your statement?
Oh, my preference would be 10 a.m. Earlier the better.
That's my preference too.
I am flexible, so I can just block out the entire day for either time.
Thank you.
Likewise, I can do any time during the day.
Yeah, I'm fine.
I'm flexible as well. Yeah.
Thank you. Okay, looks like we have a time. So our next meeting will be held on July 10th. Huh? So, yes, July 17th, please forgive me, at 10 a.m. Thank you.
The PowerPoint presentations that we saw today, can we get copies of them?
Yes, we'll make sure that they're online, but we'll have them sent to you directly. And I believe we'll get that information also from Dr. Ford to post on.
So until the next meeting, how does the agenda setting work?
So hi, this is Germana. So I will, if you have any agenda items that you want to propose for next meeting, you can email those agenda items to me, and then we could prep those ahead of the next meeting. I will also, certainly with Capri's leadership, work with the ad hoc committee to put together a draft of proposed bylaws, and we will work with the city attorney's office, and we will have those proposed bylaws for the full board to review at the next meeting. And in the meantime, if there are any other agenda items that any of the commissioners are interested in wanting to see on the agenda, please email those to me as well.
Thank you.
Thank you. Unless there are any other questions or comments, we can adjourn our meeting at 4:11.
Thank you.
Thank you, commissioners.
Thank you.
Thank you.
Thank you.
You guys did today. Thank you very much.
Congratulations on your all of our first meeting. Thank you.
Yes.
Have a great weekend.
All right.
Thank
Bye,
you.
everyone.
Take care.